In the 21st century, India is sending rockets into space, but tens of millions of its citizens are still squatting in fields to defecate. It sounds absurd, maybe even offensive, but it's true. And it's keeping the country poor. Because when human waste fills rivers, streets, and schoolyards, it doesn't just smell. It spreads disease, it stunts children, it steals billions from the economy. This isn't about embarrassment. It's about collapse of dignity, of health, of progress. And while the government claims the crisis is solved, the reality is far filthier and far more dangerous. In this video, we're breaking down the economic, cultural, and human toll of India's sanitation crisis and why no superpower can rise on contaminated ground. Here's what they don't tell you in those shiny India Rising headlines. What they conveniently leave out when they're showing you gleaming tech campuses and billionaire success stories. In 2022, over 160 million Indians still had no access to toilets. Picture that for a moment. That's more than the entire population of Russia, more people that live in the UK and Germany put together. And in rural India, those numbers get even uglier. 1 in 4 households, 25% of families, still don't use a toilet. They go outside, into riverbeds and roadside ditches, along railway tracks where children play, behind whatever cover they can find in the dim light of dawn. The Indian government will tell you they've won. In 2019, Prime Minister Narendra Modi stood before the nation, chest puffed, smile wide, and declared victory over open defecation. He announced that India had built 110 million toilets in just 5 years under the Swachh Bharat mission, the Clean India campaign. Mission accomplished. Problem solved. Right? Dead wrong. Because building toilets and using toilets are two very different things. And this is where the story gets darker. Studies have found that 23% of people who owned government-built latrines still defecated in the open. The same percentage as before the campaign began. The same filthy habits, the same deadly consequences. Why? Some toilets were never finished. No water supply snaking through the pipes, no working drainage. Ghost toilets built on paper, pocketed by corruption. Others were converted into storage sheds for grain and tools. Families actually used their government-provided toilets as glorified closets. And millions more just sit there, empty, unused, gathering dust while people walk past them every morning on their way outdoors. Which brings us to the brutal economic reality that should make every Indian politician's blood run cold. India loses $54 billion every single year to inadequate sanitation. That's not a typo. $54 billion, or 6.4% of India's entire GDP in 2006. Gone. Flushed away. Literally. Money that could build hospitals, schools, roads, infrastructure that actually works. Instead, it's hemorrhaging out of the economy like blood from an open wound. But that's where it gets truly horrifying. Because this isn't just about toilets or economics. It's about children dying, slowly, painfully, from something that was eradicated in the developed world over a century ago. Let's talk about the death toll nobody wants to count. Every year, around 100,000 Indian children under 5 die from diarrheal diseases directly linked to poor sanitation and contaminated water. 100,000 innocent kids. That's 207 children every single day. 11 children every hour. A classroom of kids wiped out before noon. That's a child dying every 5 minutes. Every hour of every day. Dying from something that could be prevented by a simple toilet. Imagine it. A mother watching her baby's life drain away. Dehydrated, fevered, convulsing. The tiny body racked with cramps, lips cracked and bleeding, eyes sunken, skin turning grey, knowing that somewhere, maybe just down the road, there's a pristine office building with spotless bathrooms and running water, while her child dies from drinking water contaminated with human feces. But those who survive, many face something worse than death: a lifetime of stunted growth and impaired development. 37 million Indian children under 5 are stunted, too short for their age, cognitively behind, physically weaker, bodies that will never catch up, minds that will never reach their full potential. Not because of genetics, not because of famine, not because India lacks food, because their tiny bodies are constantly fighting fecal pathogens in their environment. Here's how the nightmare works. When open defecation is widespread, human feces contaminate the soil and water everywhere. In the fields, in the streams, seeping into the wells and groundwater. Children play in dirt laced with deadly bacteria. They drink water crawling with parasites. Their intestines become chronically inflamed, like open sores that never heal. Their bodies can't absorb nutrients. They get sick, recover slightly, then get sick again. Over and over and over. This cycle of infection, called environmental enteropathy, literally steals their childhood. The World Health Organization estimates that 50% of malnutrition worldwide is linked to repeated diarrhea and intestinal infections from unsafe water and poor sanitation. In India, that percentage is likely even higher. And here's the cruelest part. India doesn't lack food. The country produces enough to feed its population. Their pantries aren't empty. The problem isn't hunger. It's that children's bodies can't absorb the nutrients because they're too busy fighting off an invisible war against fecal bacteria. As of 2024, India has the highest child wasting rate in the world, 18.7%. Over 21 million children are being affected. Their bodies are literally wasting away, growth stunted forever, brains that never fully develop, immune systems permanently weakened. This is India's invisible humanitarian crisis. No bombs falling, no wars, no famines, just millions of kids condemned to diminished futures because there's human waste in their water and soil. And while this silent tragedy unfolds, let's talk about where all that money is actually going. Because when we say India loses $54 billion annually, that's not an abstract number on a spreadsheet. That's real money, real resources, real opportunities vanishing like water down a broken drain. That $54 billion annual loss breaks down like this, and every category is a punch to the gut. Health costs alone were estimated at $38.5 billion in 2011. That's the biggest chunk. Premature deaths, endless hospital visits, medicine families can't afford, treatment for preventable diseases like cholera, typhoid, hepatitis, and parasitic infections that were wiped out in the West generations ago. Think about what this means in practice, what it means for hundreds of millions of women. Every day across India, women wake up at 4 a.m. because cultural modesty demands that they not be seen defecating. They wait for darkness to fall like a curtain of protection. They travel in groups for safety, clutching sticks to fend off snakes, stray dogs, and human predators. And they live in constant fear. One mother in a Delhi slum told researchers something that should make your blood boil. We have had one-on-one fights with thugs in order to save our daughters from getting raped. It then becomes a fight that either you, the thug, kill me to get to my daughter, or you back off. Read that again. Mothers fighting off attackers with their bare hands to protect their daughters who just need to pee. This is the daily reality for millions of Indian women and girls. And it's not just about violence, it's about health being sacrificed on the altar of modesty. Women who hold their bladders for hours waiting under nightfall suffer from chronic urinary tract infections and kidney problems. Their bodies are literally being damaged because they can't safely use a bathroom. Girls miss school during menstruation if there's no private toilet available. Some drop out entirely once they hit puberty, their education ending because of a lack of basic sanitation, dreams evaporating, futures vanishing. The lack of sanitation is literally stealing education, opportunities, and dignity from an entire generation of Indian girls. Mahatma Gandhi understood this a century ago. He famously said, "Sanitation is more important than independence." He meant that true freedom, true dignity, starts with the ability to perform the most basic human functions safely and privately, without fear, without shame. India won independence from Britain in 1947. The British left, the colonial chains were broken, but millions of Indian women are still not free. They're prisoners in their own country, held captive by the lack of a simple toilet. And here's what makes the entire crisis so baffling, so infuriating, so completely inexcusable. Ancient India actually invented urban sanitation. The Indus Valley civilization 4,000 years ago, when most of the world was living in filth and darkness, built the world's first urban drainage system. Sophisticated clay pipes, covered sewers, public baths that Romans would later copy. At a time where Europeans were throwing chamber pots out their windows into muddy streets, ancient Indians had figured out that waste needed to be managed, contained, and disposed of properly. Rome gets all the credit for its aqueducts and sewers, and rightfully so, but India was there first. India invented this. So, what the hell happened? Let's look at the countries that face similar challenges and actually solve them. Bangladesh, poorer and more densely populated than India, reduced open defecation from 34% in 2000 to just 1% in 2015. How? Community-led campaigns promoting simple, affordable pit latrines. Behavior changes at the village level. Social pressure making open defecation unacceptable. And importantly, Bangladesh didn't have the same caste stigma around pit emptying. People were willing to adopt toilets that needed maintenance. Singapore in 1965 was a poor, overcrowded slum, with inadequate sanitation festering in tropical heat. Prime Minister Lee Kuan Yew made cleanliness a cornerstone of nation building. Strict enforcement, heavy fines for public urination and littering, zero tolerance. Within a generation, Singapore transformed into one of the world's cleanest, most prosperous cities. The filth was scrubbed away and prosperity followed. Japan centuries ago had systems to collect night soil, human waste, and use it as fertilizer for crops. By the late 1800s, public health became a national priority during the Meiji Restoration. Today, Japan has the longest life expectancy on Earth, and waterborne diseases are virtually non-existent. Even Ethiopia and Cambodia, much poorer than India, made faster progress in reducing open defecation over the past decades. The common thread? These nations treated sanitation as fundamental, as important as electricity or roads or education. They combined infrastructure with intense behavior change campaigns. They shifted cultural norms through social pressure and education. They changed their minds, not just built toilets. India built toilets, but it couldn't change the minds. And so the toilets sit empty while the crisis continues. In October 2019, on the 150th birthday of Mahatma Gandhi, Prime Minister Modi stood before cameras and declared India open defecation free. The government announced victory with fanfare and celebrations that cost millions. They announced that the Swachh Bharat mission had achieved its goal, 110 million toilets built, mission accomplished, victory. India had supposedly accomplished in 5 years what other nations took generations to achieve. The celebrations were massive. Fireworks lit up the sky, parades marched through the streets. The government spent millions on advertisement and publicity campaigns, plastering Modi's face on billboards across the country. India had supposedly solved a crisis that plagued its independence, a crisis that Gandhi himself had warned about 75 years earlier. Politicians smiled for cameras, hands clasped in triumph. Officials collected awards at international conferences, and the international community applauded India's achievement, holding it up as a model for other developing nations. But on the ground, reality painted a very different picture. Independent surveys by WHO and UNICEF found that as recently as 2022, 11% of India's population, over 100 million people, still defecate outdoors. Rural India tells an even starker picture. 25% of rural households lacked basic sanitation facilities. The government declared victory, but the war was still raging. What went wrong? Everything. First, many toilets were built on paper but never completed in reality. Corruption siphoned off funds like water through a sieve. Contractors cut corners, pocketing the difference. Toilets were constructed without water connections or proper drainage. Ghost toilets on government spreadsheets, non-existent in villages. Second, even properly built toilets often went unused. That 23% statistic haunts this story. Nearly a quarter of people with access to toilets continued defecating outdoors. Habits unchanged, patterns unbroken. Third, maintenance was completely ignored. Toilets broke, pits filled up, nobody took responsibility for repairing or emptying. Within months, many became unusable. Within a year, they were abandoned. The government measured success by toilets built, not toilets used. It's the classic bureaucratic mistake of treating a cultural crisis as an infrastructure problem, of thinking you can change thousand-year-old beliefs by pouring concrete. And now we come to the truly terrifying part, the permanent damage that could never be undone. Those 37 million stunted children we talked about, they're not going to magically recover. Stunting in early childhood causes permanent cognitive impairment. These aren't temporary setbacks that better nutrition can fix later, it is forever. Irreversible damage written into their bodies and brains. These kids will grow into adults with diminished mental capacity, lower educational achievement, and reduced economic productivity. They'll score lower on tests, struggle to learn complex skills, earn 20% less over their lifetimes compared to their non-stunted peers. Their brains didn't develop properly because their tiny bodies were busy fighting fecal bacteria instead of growing neurons and forming neural connections during the critical first 1,000 days of life. The World Bank estimates that India's burden on stunting results in losses equivalent to 22% of its disease burden. 22% of all health problems in India can be traced back to children who were stunted in early life. Think about the compound effect rippling through generations like a stone dropping in water. Stunted children become less productive adults. They earn less money throughout their lives. They're more likely to remain poor, trapped in the same economic quicksand their parents struggled in. Their own children are more likely to be malnourished because poverty begets malnutrition begets poverty. The cycle repeats, the wheel turns, and nothing changes. This is how poor sanitation doesn't just hurt one generation, it traps entire communities in multi-generational poverty. A curse passed down from parents to children like a genetic disease. And it's not just about children. India's workforce is less productive because workers get sick more often. Call in sick, miss deadlines, can't focus because they're weak and ill. Healthcare systems are overwhelmed with preventable diseases. Every hospital bed filled with patients who shouldn't be there. Every doctor treating cholera instead of cancer. Tourism suffers because foreign visitors are repelled by the filth. They see garbage heaps and open sewers and open defecation, and they leave. They don't come back. They warn others not to visit. Foreign investors look at India's sanitation crisis and see deeper problems lurking beneath the surface. They see weak governance, poor infrastructure, and inability to implement basic public services. These perceptions matter when companies decide where to build factories, where to invest billions in capital, where to locate regional headquarters. India is fighting for global economic leadership with one hand tied behind its back. You simply cannot become a developed nation while hundreds of millions of your citizens lack access to basic sanitation. You cannot claim superpower status while your daughters risk rape just to use the bathroom. And here's the most disturbing part that keeps development experts awake at night. All of this is solvable. India is now the world's 5th largest economy. It has the resources, it has the technology, it has engineers who can build rockets that reach Mars, it has the knowledge of what works. Bangladesh did it with far less money. Singapore did it in a generation. Even much poorer countries in sub-Saharan Africa are making faster progress than India. So why can't India solve this? Because money can't buy cultural change. Because you can't legislate away caste stigma that's been reinforced for thousands of years. Because as long as emptying a pit makes you untouchable, people will avoid affordable toilet systems. Because as long as communal hygiene is seen as someone else's job, public spaces will remain cesspools. Because as long as open defecation is viewed as traditional or even healthy, education campaigns fail. The government can build 1 billion toilets. It won't matter if people refuse to use them or maintain them. And here's the brutal irony that makes this even more tragic. India's GDP growth actually masks the problem. The economy grows. Skyscrapers rise in Mumbai and Bangalore. Tech companies boom. Indian billionaires join the global rich list. And politicians point to these as proof of progress. Look how far we've come, they say. Look at our growth rates. Meanwhile, around 150 million people are still squatting in fields covered in their neighbours' feces. The sad truth is that India might never fully solve this crisis, not in our lifetimes, because the cultural barriers are simply too high, too deeply embedded in the national psyche. What would it take to actually fix this? A complete reimagining of caste attitudes. A generation-long education campaign targeting children before prejudices form and harden. Strict enforcement of sanitation standards with real consequences, fines, jail time for non-compliance. Most importantly, Indian society must decide collectively that human dignity matters more than tradition, that children's lives matter more than ritual purity, that women's safety matters more than ancient customs. That hasn't happened yet. And until it does, India will remain a nation of paradoxes, a country launching satellites into space while its citizens dodge feces on their way to school, building nuclear submarines while its daughters risk rape just to go to the bathroom, hosting international tech conferences in air-conditioned convention centers while sewage flows through the streets outside, producing billionaires at record rates while babies die from drinking contaminated water, positioning itself as a 21st century superpower while drowning in 19th century filth, dreaming of Mars missions while millions still can't safely answer nature's call on Earth. Ancient Rome understood 2,000 years ago that sanitation was the foundation of civilization. No empire could rise without it, no economy could prosper, no population could thrive. The Romans built their aqueducts and sewers and became the greatest empire the world had ever seen. Their cities supported millions of people because they understood that waste must be managed. India forgot this lesson, or rather, India chose tradition over progress, caste over compassion, cultural pride over children's lives. And the cost has been staggering. $54 billion bleeding out every year, 100,000 children die annually, 37 million permanently stunted, their futures stolen before they could walk. 150 million people still live without dignity, forced to defecate outdoors like animals. This is about stating a simple, undeniable fact that history has proven again and again. No nation can escape poverty while its streets are covered in human waste. You can build factories, you can educate workers, you can pass economic reforms and attract investment and sign trade deals. But if your population is sick, stunted, and trapped in cycles of preventable disease, if your women can't safely leave their homes, if your children's bodies are fighting fecal bacteria instead of growing normally, then all the GDP growth in the world won't matter. The foundation is rotten, the bedrock is contaminated, and you can't build a skyscraper on quicksand. Until India fixes the most basic problem, where its people go to the bathroom, the country will remain shackled to its past, unable to claim the prosperous future it desperately wants to reach. Gandhi was right all those years ago when he said those prophetic words that India still hasn't heeded. Sanitation is more important than independence. India is free from colonial rule, the British are gone, the chains of the empire were broken in 1947, but it's still imprisoned by its own waste, still trapped by its belief that are killing its children and destroying its future. And unless something changes, unless the culture shifts, unless the stigma breaks, unless Indian society finally decides that human life matters more than ancient traditions, this crisis will continue. The toilets will sit empty, the fields will stay filthy, the children will keep dying, and India will never become the superpower it dreams of being. So, what do you think? Can India ever truly solve this crisis, or will the cultural barriers prove insurmountable? Is the cultural resistance too strong, the caste system too entrenched, the problem too deep to ever truly be solved? Let us know in the comments what you think it would take to finally break this deadly cycle once and for all. And if you're wanting more hard-hitting analysis of the geopolitical crisis shaping our world, subscribe to Fall of Nations, because we're not afraid to talk about the issues everyone else ignores.